I was prescribed an antipsychotic. Does my provider think I'm crazy? Do they think that I'm hearing voices or seeing things that aren't there? Because I'm not. I'm Lindsay, I'm a psych NP. I've been a psych NP for 9 years, and I wanted to talk about something that I think is really important. Just because you're prescribed an antipsychotic does not necessarily mean that your provider is prescribing that to you because they think that you are actively psychotic. We use antipsychotics off-label in psychiatry for other conditions as well, such as bipolar disorder, sometimes even treatment-resistant depression. And so we need to keep that in mind. Also, just because we prescribe a mood stabilizer like Lamictal doesn't mean that we think that you have bipolar disorder. It is not black and white in psychiatry. And I think that because of the stigma associated with some of these classes of medications or names of meds, it's easy to get really freaked out and think oh my gosh, my provider thinks this or that, when in all actuality, we use a lot of these medications off-label. We have to weigh the risk and the benefit. For instance, when we're treating psychotic disorders, okay? Psychosis is not a diagnosis, it's a symptom. But in theory, people develop psychosis because of excess dopamine. So we use antipsychotics, which block dopamine. Now, these are really powerful medications. We do see a lot of side effects because of the dopamine blockade, and that can be problematic. And that's why, again, we really have to look at the specific patient and if, in their case, the benefits are going to outweigh the risks. So anyway, I just wanted to go off on that little tangent because I just think that there's a lot of people who freak out because their provider prescribes them something. They go home and then they're like, and if you don't tell your patient that, it's driving me nuts. Like, hey, I'm prescribing you an antipsychotic, but I don't think it's not for psychosis. That's not why I'm prescribing it. Then yeah, they're going to get a little bit freaked out. Wouldn't you be freaked out? So, okay, off my soapbox.